On to health news now. You know, it's an interesting time to be pregnant, as you can probably imagine. Thanks to COVID-19, there are no gender reveal parties, baby showers, or hospital visitors for expectant parents. I talked to two moms about what it's like to be pregnant during a pandemic.
Oh wow.
Parenthood doesn't come with a manual, but this time around, Sarah Ruth wished it did.
So it's just a lot of change.
Sarah gave birth to her second child, a healthy daughter, days ago, choosing to induce 2 weeks early to make sure her husband and doula could be with her.
Given the circumstances, I think we made the best decision we could have made.
Tasia Oliphant and husband Ryan pivoting their birth plan as well, the couple avoiding hospitals altogether.
We're changing up everything.
Saying their fourth child, due in mid-April, will now be born at home.
We live close to a hospital in case I need a transfer. So it just feels like at the moment our home is safer.
Data on infants born to mothers with COVID-19 is limited. So far, 3 reports published in the Journal of the American Medical Association suggest vertical transmission, or the spread of infectious disease from mother to child, is unlikely but not impossible.
Thankfully, we have not had that yet. We've had some people that have had symptoms that have been negative.
Obstetrician gynecologist Sheila Chitani says even if a mom has symptoms of COVID-19, or let's say she tests positive, labor and delivery is essentially the same as it would be otherwise.
Her delivery is based on obstetrical considerations as far as whether or not she has a vaginal delivery or a C-section. And then we take precautions in order to protect the baby.
At Texas Health in Dallas, protections look like this. Anyone entering the hospital is required to wear a mask, but not during delivery. And only essential people are allowed in. Those rules varying depending on your hospital, state, and city or county. Once the baby goes home, additional considerations. Newborns lack an immune system, so limit visitors. Careful hand washing is critical, and moms should wear a mask during breastfeeding. Dr. Chitani says it is okay to breastfeed even if mom has COVID-19.
Given the circumstances, yeah, we're doing well.
Sarah and Tasia both had low-risk pregnancies, excellent prenatal care, and remain healthy.
Both of us feel much more at peace.
Standing nervous but ready are the healthcare workers, also navigating pregnancy care during a pandemic without a manual. All right, now I know that you've got a lot of questions about this topic. I'm joined now by Dr. Leanne Haddock, an OB-GYN with Baylor Scott & White Health. Good morning, Dr. Haddock. We appreciate you joining us. So first, the women I featured were both low risk, but for the ladies who might be dealing with a high-risk pregnancy or women who have diabetes, high blood pressure, asthma, what is your recommendation as far as home birth and delivery?
Well, the data is still there. We still believe that a hospitalized birth is the safest by far, and especially if you have risk factors. And with everything here we're doing at Baylor University Medical Center too, we are taking all precautions. There is a COVID drill almost every day. That I think it's one of those things that it is a safe place to deliver whether you have it or you don't have it. And so if you have medical problems, yes, you should be in the hospital.
And I know I spoke with Dr. Chitani about limited visitors and wearing masks at Texas Health. What is the policy right now at Baylor?
Well, Baylor right now for the hospital in general is not allowing visitors under less specific circumstances. But in labor and delivery as of now, that your partner is able to be there with you, one person. You know, we have screenings right even before you enter into labor and delivery. So everybody gets screened before you even come into labor and delivery. And so that's the plan. The unfortunate thing, and this is still very fluid, which makes it very hard for all of us to understand, is that if you do have active virus and actively have coronavirus at the time, you may or may not have a partner with you at that time. Now, that's still very fluid, and I don't want to put that in stone, but to know that, you know, we want to make this the best birth experience ever. We're going to try to do everything we can to support our patients. It's scary, and we're learning stuff every day.
What about the kind of choice or the option between a C-section and a natural birth? I know there are a lot more people in the room when you're dealing with a C-section.
Correct. I think right now that still needs to be a discussion with your obstetrician. It's not that you absolutely need to have a C-section, or I have a lot of people saying, do I need to come in and be induced early because of this? That's still not the case. I mean, we still at this time are allowing patients to have the choice, and a vaginal delivery is still very appropriate if that is what you're supposed to do. So it's not recommended to absolutely have a C-section. And because a C-section has risk itself too. It's a riskier procedure. Yes, there are more people involved too, but everybody that's involved, if there's any question, is very careful on our PPE, the personal protective equipment that we need to have at that time.
I've had a lot of questions saying, Sonia, my partner and I are trying to get pregnant. Is now the time to do that?
I think it's very appropriate. I mean, this is changing. We don't even know what a month, we don't even know what a week is going to look like, or a month or 2 months from now, too. I jokingly have always said, if women stop having babies, we got bigger problems on this earth. But saying that, it is one of those things that, it is still appropriate to have babies. There's no reason why you absolutely have to wait unless that's your personal choice. We're finding pregnant women do very well so far with coronavirus. The limited data that we're seeing, at least we don't think it's passing through the placenta. So if they do get coronavirus during pregnancy, we're finding that women and babies do very well. It's really the time of delivery we have to be very careful for the contact.
Prenatal care is still essential, right? Especially in the third trimester when you're checking the status of the fetus, the placenta. Is there any scenario where you tell a patient to skip those visits?
There actually are. When we look at the big picture of when patients come in, I always tell some patients, I always say you're kind of in the sweet spot where there actually is a time frame where I don't need to see you in the office. We are now implementing telemedicine, which has been very unique and new for all of us, but we're learning it. And I have some patients that I talk to and remind them we are here if there's any problems. But there are times that they can skip a month and come back in the next month. And maybe by that time we'll be in a better position out of this quarantine and it is safer to come in. But we are trying to limit the patients that we see in our office to those that absolutely need to be seen for whatever specific reason, whether it's to be checked or a specific lab test, so that women are getting good prenatal care. We're just kind of able to push it out a little bit, and of course with the comfort of the patient.
Yeah, and always on a case-by-case basis. Dr. Haddock, thank you so much for your time and your insight.
You're welcome.
We appreciate it, and please do, you and your staff, stay safe. Okay, well, I want to share with you guys.
We are working hard. Thank you.
Yeah, absolutely. Here's a way for expectant mamas to keep up with your mental and physical health. It's called Unique Footprints. The founder is a neonatal nurse. This is a terrific one-stop shop for all mothers. You've got online access to prenatal yoga, a pregnancy food guide, prenatal psychology, and preparing for childbirth. You can sign up at uniquefootprints.com, and I will post all of this information to my social media channels for you as well. Please do share the love with women you know who might need it. We'll be right back.